I'm Pamela Wu, and with me today, virtually, is Dr. Allison Brashear, the Dean of the UC Davis School of Medicine. This is September, and September is the American Medical Association's Women in Medicine Month. It's a month to showcase the accomplishments of women physicians and also to highlight advocacy related to women physicians and health issues that affect women patients. Today, we're going to be discussing the important role of women in medicine and Dean Brashear's unique role in being a champion of women in medicine as well. And as always, if you have questions today, you can post them in the comments and we will do our best to answer them toward the end of the discussion. Dean Brashear, great to see you. Thank you for being with us.
Thank you.
So September is the AMA's Women in Medicine Month, a time to celebrate women physicians. What does this month mean to you?
Well, as a woman physician and a woman leader, I think it's incredibly important that we hold up role models and we both inspire future women to enter medicine. There is no more time now than to really energize those young minds to begin to enter medicine. And I just think it's so inspiring to see so many women in healthcare that have made a difference.
This year's theme for Women in Medicine Month, for those who don't know, there is a theme every year. This year's theme is Advancing Equity, Creating Change. What does that theme mean to you?
So advancing equity and creating change to me means that you're very purposeful. So you're really looking at how you're going to bring women leaders along. Some of that is by having processes to make sure that your hiring and advancing processes are transparent and that women are given equal chances. Some of that's also about something called sponsorship, where we actually as leaders promote women and give them opportunities. You know, too much of leadership is about who you know, and too often who you know is not necessarily a woman. And so we as leaders need to be very purposeful in making sure that our leadership is diverse.
I want to break down this theme a little bit too. These 4 words: advancing equity, creating change. Just what kinds of equity do you want to see advanced, and through what kinds of change?
Well, we know if you take it to the patient level, the patients do better when they see a doctor who shares their background. We know that women really like to see women doctors, and we need to have equity and to actually improve health. So we also know that when you have a diverse group in a room, that change happens because you don't have groupthink. People begin to think differently, and you have more diversity in your leadership, in your room, in your committee, wherever. You're going to be more creative, more innovative. And nothing has shown us more than this current pandemic that we need to be creative and innovative. We also know that change is expedited now. You know, change used to be you do something over a couple of months and you plot it out. And now we are doing change in real time. And that is just going to be helped by having a more diverse community leading that, participating in it.
And it really feels too like it's never too early. I know that you have previously shared how much your mother inspired you. And I wonder if you'd care to share with us a moment or a time when she taught you about the importance of advocating for women's rights and equality.
So my mother grew up where women didn't have many opportunities. She got a PhD when I was in elementary school. And when I was in middle school, she took a friend of mine from Indianapolis, and we were in the gallery during the hearing of the Equal Rights Amendment. As you can imagine, back then in Indianapolis, the words that were said about why women did not need equal rights were something that's ever blazed in my brain. My friend and I still talk about doing that. And so she taught me early on that you need to be out in front. You need to be clear. You need to be very purposeful about what you do. She left a tremendous legacy that empowered women really throughout all of Indiana, and women there are still benefiting from the processes that she set up in that community.
That is amazing. It's really through the generations. It's generational change.
That's exactly right. And that's actually one of the important things about medicine. So We've had women be 40% or more of the classes since the mid 90s, but we still do not have a large representation of women in the professor roles, chairs. Professors are 25% women in academic medicine, chairs 18%, and deans 16%. For a group that's been 40% for many, many years, those numbers don't add up, which means we need to do more. We need to be purposeful. It's not a pipeline program. That's not the problem. Pipeline is not the problem. It's that the pipeline's been full for a long time. The problem is on the selection, advancement, sponsorship, all those other things. I had someone tell me it was a pipeline program, and I just said, no, the pipeline has been full for a long time.
It's been backed up for a while.
That's correct.
With women who are ready to learn. Let's dig a little bit deeper in what you're saying about leadership and specialized programs too. You're a neurologist by practice. Is neurology a specialty field that many women pursue?
Unfortunately, only 11% of the neurology chairs are women. We are getting more and more in neurology who are women. I am so pleased to say that on October 1st, there'll be 3 new women chairs in neurology across the country. One here at UC Davis, Dr. Amy Cale Brooks, one at my alma mater, Indiana University, Dr. Lori Gutman, and one at our fellow UCs, Claire Henschke. And so we're really proud. I think that's actually a product of a lot of work on the part of the neurology community, because we developed leadership programs for women that helped give women those leadership skills to be able to be successful in searches and get their name out there and, really be on the front line of leading change.
What are some of the barriers that you see to women pursuing these specialty fields in medicine and research?
So, we talk a lot about mentorship, and I think mentorship is incredibly important. We need role models. We need women to be successful. We need women to be NIH-funded investigators. We need women to be leaders, chairs, professors. But we also need something really special called sponsorship. And that's different than mentorship. Mentorship's where someone talks to you about what you want to aspire to do. But sponsorship is where someone has skin in the game. So they risk their own career, reputation, and bring you in and say, I'm going to bet on you. I'm going to give you some opportunities. And I believe in sponsorship. And I believe then you really are advancing the ball. Women don't need more committee work, or they don't need more, go off and take this course. And heaven forbid if someone says, you just need to be nicer and quieter, get along, right?
Right. Smile more.
Right. And, I was the only chair of neurology in the South. Where I was the only woman chair, I was the only woman on our board of directors. We need to get beyond where we're telling women to follow these traditional roles. And we need to make sure that we're giving them opportunities. So that's what sponsorship is. And that's so important that we all live and breathe that.
We are with Dean Allison Brashear discussing Women in Medicine Month and celebrating women physicians. If you have questions, please post them in the comments here on Facebook. We will do our best to answer them toward the end of the discussion. Let's stay on the distinction between sponsorship and mentorship. To me, it sounds like what you're saying, and correct me if I'm wrong, because I really want to understand it. It's like mentorship is like, I think this job would be great for you. We've worked together. I think you could do this. Sponsorship is like speaking up on behalf of the person, maybe serving as a reference for them. You said skin in the game. Is that a good example?
Exactly. So I'll give you a great example of sponsorship where I learned early on. I was a well-funded researcher at Indiana, and a woman, senior dean and the male dean gave me an opportunity to lead a committee. And she called me up and she said, you're the youngest person on the committee and the most junior, but we think you can do it. And then They made sure that they stood behind me, coached me on how to do it. And it ended up being the clinical research strategic plan for all of IU School of Medicine in 2005. And that was my best example of sponsorship, where you give someone an opportunity and you set them up for success. The other thing I want to remind everybody, because I know that there's a lot of young women out there, when someone does that for you, just make sure you say thank you and you keep in touch, and you give back. Because if I sponsor someone, I usually tell them, now your payment to me is you do this for somebody else.
Yeah, pay it forward, keep it
Pay
going.
it forward. That's exactly right.
Medical schools often have more female students than male students, especially recently, and especially at UC Davis. To what
Right.
do you attribute that?
So I'm very proud that I'm the third woman dean in a row. So we have two very esteemed women that I'm following, and I'm very proud to follow Claire and Julie. I think that says a lot about what is important to UC Davis. I also know that UC Davis has been very thoughtful in making sure that our medical school classes represent a diverse community here as we see to go and improve health, particularly in Northern California. So again, I think that, it's really about being thoughtful, having role models, being really public about you're really committed to diversity. And I think that that is no more important now than it ever has been with the pandemic.
How can physicians, both male and female, empower female medical students to continue to pursue medicine, some of the more challenging specialties, leadership positions, all of that good stuff?
So I think there's a lot of things, as leaders, we can set up programs, we can be role models, we can make ourselves available. But the other thing I would also say is I think each and every one of us should focus on doing the little things. It's always amazing to me how students remember the little things. And they remember the things that you did to advance them versus the things you didn't. And so I can look back on my career and I can remember the little things that people did to push me forward, to say that I could do that, to do some sponsorship. People remember that, and particularly for young women, there is a lot of data out there about when you actually tell a woman that they can do something, it goes a long way towards getting over that imposter syndrome and those other things that hold us back. There's good science there. I think the other thing is we need to be able to hold our institutions accountable. So it's not good enough just to have searches that say they're open to women and minorities. It means that you need to have the institution be responsible to go out and actively source. There's good information to say that if women are not asked to apply for a position, they won't. Men don't usually follow that. If they see something cool out there, they have a little bit, it's pretty well known. They'll go out and, if they don't get it, they don't get it. Women usually need to be asked. And so I actually have been committing myself to develop a somewhat informal network of senior women who go out and champion other senior women. That's the way the world works, unfortunately. And we all need to be out there to make sure that, the next dean here is a woman, that we have many more 50-50 women chairs. It's interesting. I realized that, orthopedics only has 0.8% women chairs. ENT has 3.5%. Even the highest is family medicine at 30%. So there's lots of work to do about bringing women into leadership roles.
At UC Davis Health, there is a longstanding group. We refer to it by its acronym WIMS. It stands for Women in Medicine and Health Sciences. Why are groups like this important?
Well, first, I just can't say enough about WIMS. It's one of the many reasons I came here. They provide a a network of women who support women. They bring, they're very good with bringing women in as associate professors, advancing them to professors. In fact, they even have a recognition ceremony where a woman who gets to be professor gets a pin and has a ceremony. So, you know, they really create a community. And for women, I think having a community that you can go to, get support from is incredibly important. They are known throughout the country for advancing women, support women for national leadership programs. So UC Davis is really very well known for this. One thing that Melissa, the director of WIMS, did is she has empowered each department to have a representative or a leader per se. And I'm proud to say that 19 out of our 26 departments have a WIMS liaison. And as dean, I'm hopeful that all 26 next year will have a liaison.
Yeah, I'm hopeful too. We get the other 7 on board.
That's right.
Do you have any, it looks like we're nearing the end of our time here. Do you have any closing thoughts on Women in Medicine Month?
So I think that women have advanced in medicine, but I really want everybody to not realize that or think things are over. You know, we really have to be very purposeful. But I am so inspired by the women that I've seen as leaders and young women, the women I've met who are medical students here, who are so committed to improving health. One way you improve health is by having a diverse group of healthcare providers. And one of the ways we're going to do that is by advancing women in medicine.
Thank you, Dean Brashear, for being with us today. We really appreciate your time and great insights.
Thank you so much.